everything that we say as part of answers is always referenced. So there's citations to everything. And so you don't actually have to trust AI at all to get value and use OpenEvidence, because you can always verify everything. And so our motto here is trust but verify. And that's really central to OpenEvidence.
So you ready? 1, 2, 3. Hello and welcome to the Health Tech Glow Up. I'm Nathan C., and today I'm talking with Zachary Ziegler, co-founder of OpenEvidence. Zach, it's so great to meet you. Thanks for joining me on the Health Tech Glow Up.
Hello.
Amazing. So to get started, can you introduce yourself and the work that you're doing at OpenEvidence?
Yeah. So I'm Zach. I'm the co-founder and CTO of OpenEvidence. We essentially make ChatGPT for doctors. We become the fastest growing, most rapidly adopted AI tool used by clinicians. We're now used by over 40% of practicing clinicians, with the average user using us every day.
Okay.
My background is technical. I'm an AI person. I come from a PhD program at Harvard, where I was working in the pre-ChatGPT days on language models and generative modeling and all that stuff. And yeah, I got really interested in how do we make these models do something actually useful? How do we make these models actually impact the world in a meaningful way? And yeah, ended up, here we are.
Were you always interested in healthcare as an application for large language models, or did that focus come out of the research that you did in building the idea?
Yeah. So ultimately, what motivates me is just making useful stuff. That's always been just the thing, to just really make things that people love and people use. And what struck me early on, myself and my co-founder, Daniel, was that healthcare sits in this space that is in so much red tape and bureaucracy. When we were getting started with this, it was one of these last very obviously yellow taxi cab era style industries where even as consumers, it was wild to us that if you want to know what does the science actually say, the best resource is WebMD, which is crazy because it is literally a meme, right? That you go to WebMD and you ask what you have and it'll tell you have cancer.
Yeah.
And then the shame is that there's so much that we know as a species. I don't think people appreciate how much medical knowledge exists and how much research exists. There's 40 million papers. There's 10 to 20,000 new or updated papers every single day. It's an enormous amount of literature.
Almost like a YouTube. I mean,
Yeah.
that's a similar content feed.
Yeah, that's right. Huge amount of context area, and yet there's no real ability to access that knowledge. And so we made OpenEvidence to be kind of a bridge between people who have needs, whether that's originally kind of when we were considering this for WebMD kind of consumer stuff, but very quickly, really focused on the physician side and providers, to bridge the gap between providers who need access to the best information and the best care and that information that really does exist in the world.
That's amazing. Could you, for the sake of those who maybe aren't in the health tech space, talk about your data sources and how you collect the research, and what is it like for a doctor to use OpenEvidence?
Yeah. So we pull data from a bunch of different sources, and we do it in a bunch of different ways. Probably the most important data that we work with is our first-party content partnership. We have partnerships with the New England Journal of Medicine, JAMA, and a whole bunch of societies as well. These are the absolute top of the top, the biggest gold standard for clinical information. This is where the best phase 3 clinical trials are published, and really the most kind of world-changing aspects of medical knowledge exist. So it's really important that we have those deep partnerships. We're able to kind of show and use figures, especially in multimedia, from those, which are really cool. And we're working on kind of further collaboration with those as well.
That's like dimensions that audio or like other modes might miss out on.
Yeah.
Like speakers, slides, and some recorded CTA thing or something. Amazing. So my kids are like ultimate AI skeptics.
Yeah.
And I've even heard at the show, right, people talking about hallucinations are real. I'm sure you've addressed it, but I'm hoping you can talk to, like, what are the risk factors for being an AI layer for like medical research and information, especially like when you're working with doctors and advising or, kind of affecting how they're making decisions about care.
So the way that we approach this problem is we focus on search, essentially, right? There's traditional approaches, ChatGPT, you might imagine, right? Which is like big black box, throw some questions and just like hope that you get good answers. We take a very different approach, which is essentially the bottom up to that top down. So we really, at the end of the day, we do search. That's what we do. And so what that means is when users have questions or clinical cases, we will find the exact right sentence, paragraph. We see our job as really being searched, just surfacing those pieces to humans. And then largely what we use, kind of what people today think about AI for, it is making really great search and then also providing a layer of fluency and conversation on that just for a kind of convenient experience. And so what that means is that everything is from the bottom up. Everything is about, true what humans have said, what humans have written, what humans have published and gone through peer review. And then also the side effect of that, which is just as important, is that everything that we say as part of answers is always referenced. So there's citations to everything. And so you don't actually have to trust AI at all to get value and use OpenEvidence because you can always verify everything. And so our motto here is trust but verify. And that's really central to OpenEvidence.
On the platform side, you potentially have, this is like just riffing, ability to understand how frequently doctors are actually clicking into those references. Is that something you're able to talk to at all?
I don't know the exact number, but it is really quite frequent. It's really important, right? If you're a doctor seeing a patient, you are responsible for making the decision. There's nobody else. And so OpenEvidence is a place that people go because it's just one layer of support. That's a really common kind of use case. But at the end of the day, the stakes are high. There's someone there, someone's life, right? In principle, in the worst case. And so having that ability to look through and double check and go to the references and see exactly what the original source material said, I can't imagine practicing using any kind of AI tools without that foundational support.
I would say that like one of the themes I've been seeing at Health, like overall, has been like AI, but there's still a human.
Totally.
And in many cases, that's part of like the rebuttal page for an AI product.
Yeah.
Right? Like, but there's a human in line, or we have this person, or there's a translator. And what I kind of find really elegant about what you're describing is that the human involved is the customer, is the doctor doing the search.
Yeah.
And so it's built in to the workflow that the human is always going to be at the front.
Yeah.
Because you're not necessarily like asking for a diagnosis. You're not asking, right? Like you're asking for the research. You're asking to get right to the specific thing that I really want to address first. And then that ability to have a conversational interface to the research for somebody who can make a decision.
Yes.
And I'm sure I'm not even going to get into the like, models can hallucinate even if they're data. Like there's something, but I love that there's a safety layer and just like a simplicity of the technology that align very well in this model. So it's very cool.
There are questions, whatever concerns, when AI is framed in a way that is kind of about replacing humans, right? And that's when you start getting into like, okay, we're going to start with some human in the loop thing, and eventually we're going to remove that and replace that human with physician. That's really not at all how we think about this, right? We really think about this AI as just a tool that is supportive of physicians. We don't think about it in terms of replacing. We also don't even think about it truly in terms of even saving time. That's the other common thing is like AI is going to save time for physicians. And the reality is then what happens is immediately health systems just start compressing schedules and giving more and more patients to each physician. So what we think about at the end of the day.
Maybe they play Wordle. Well, there's no guarantee that it's going to efficiency.
Physician lines are hard enough. These for-profit hospitals, these are efficiency machines. They're just going to, any amount of saved time really just increases the amount of patients people have to see. So what we care about and what we focus on truly with OpenEvidence is how do we make doctor lives easier? How do we make it just not faster, but just truly easier to do their job?
There's a little bit that you hinted at about like leveraging information to combat some of the challenges of the weird investment structure in healthcare that I'm not even going to touch, but is like super cool. Like some very interesting ideas. So thank you for that, Zachary. This is like such a cool technology. And to have 40% of practitioners in a daily, actually, how long did it take you to get to daily use? Like that's.
Yeah, well, we started about 2 years ago releasing OpenEvidence, but it's really just in the last year that we have absolutely exploded and taken off. We've been growing about 30 to 40% month over month. So, in our early days, that was small numbers, but the nature of exponential growth is all of a sudden that gets very big, very fast. We're adding 60 to 70,000 clinicians per month at this point. And it's fantastic. We're thrilled to be making a difference and to be making really fantastic tools.
60 to 70,000 a month gets to millions really fast.
Yes.
That's cool. Amazing. So let's go a little bit bigger. Let's look at the industry, look at why we're here. The podcast we're on right now is the Health Tech Glow Up. A glow up is a notable rebirth, a transformation. Looking at the healthcare industry, like you're already solving some of these core problems and like working on some of these hot issues. I'm curious, what's the perspective? What's the goals that you have for healthcare, for practitioners? What's the big audacious goals that you have for healthcare and health tech in the next 6 months to a year?
Yeah. Well, I think it's this really interesting moment where it feels like kind of all the dust has been kicked up and there's questions around like, how does Scribe play into things, right? How do clinical co-pilots play into things? Does integration matter? Does integration not matter, right? And so I think what I'm really intrigued by is like where, how does this all land? Kind of like what as this kind of normalizes into physician flows, like, healthcare is an enormously varied space, right? It's not just one thing. Practice looks like enormously different in many different situations. And so I think it's a really exciting moment where it's never been easier to build AI tools, right? Or to build any tools at all with just how fast it is increasingly to build products. And so I think it's a really interesting opportunity to run as fast as we can at building the most useful tools for physicians to make stuff that really find the places that can help every physician. I'm especially really interested for our part in, how far can we push these models? How far can we push medical reasoning? How far can we push medical intelligence? Is there anything like that really starts to approach medical superintelligence that we can build with the foundation of the literature and guidelines and practice information, but as we especially level up reasoning and those sorts of capabilities. So that's what I'm really excited about. We're working on some of that stuff, and we'll see.
Is there, not to pin you down to any of these specific goals, but for medical superintelligence, what would be the first problem you would go solve?
Well, the reality is, I think it's a big spectrum, right? There's OpenEvidence, like, is super intelligent from in specific instances. The ability to have 40 million papers condensed into one tool that you can kind of query from and get access to is something that
executive summary.
You can't do that, right? So there is something that is special about that. But there are also plenty of aspects that I don't think we're going to recreate for a very long time, right? I think human intuition, physician intuition and experience is so important and so critical. I think we'll figure out how to continue to mesh those pieces. So, yeah.
That's going to be my new AI. Amazing. You kind of actually answered a little bit about the glow up for OpenEvidence. You teased this question that I have to come back to. Are integrations important or are they not? Do you have an opinion on that?
I think they're okay. I don't think they're existential. I don't think they're critical. When I talk to clinicians, what I hear is the core value, the core thing that is really important is being able to just get fast answers, fast, trustworthy answers to questions, right? The idea that you can pull out your phone when you're standing outside the patient room, ask a really challenging but important question, and get an answer right away that is easy. It's that ease of use. I think that's the thing that we always push for, ease of use and low barriers.
I often cite ease of integrations as the fastest path to ease of use and meeting customers where they are.
Yeah.
But if you're in a world where you can build AI tools quickly and a doctor actually doesn't mind pulling out their phone to get the answer that they need in the moment, and maybe that's their preference, change it if it's not,
I mean, in healthcare especially, right? And physicians are essentially just they are force-fed EHRs. And it's one of the most interesting, well-cited facts that I keep coming back to, and it's just it keeps bopping around in my head is that EHRs themselves are cited as one of the top 3 causes of burnout by physicians, right? I mean, what a crazy profession to live in where the technology that your administration is often forcing on you is the very thing that is I have to click all these buttons. It's a huge pain in the ass. Why do I have to do this? And so for physicians specifically, I don't think they'll love their existing EHRs. And I'm not sure they're boy, what I really want is more EHR. You know what I mean?
Yeah. EHRs are the TPS reports. Health tech is what I've just learned there. Zach, you're pushing on some of the conventional wisdom that I like to talk about in a couple different areas.
Yeah.
I'm trying not to be upset about it. Let's jump to the next thematic question as a diversion. The theme for the show this year is heroes and legends. And I'm using it as an opportunity to ask people about the mentors, heroes, and others, both in healthcare and in innovation. Sometimes just having one person believe in you and say, keep going, can have transformational effects. And so I'm using this opportunity to try to get to those stories. Are there people who or organization, heroes, legends in any way that have inspired you on your journey as an innovator?
Well, maybe not quite mentor specifically because
Sure.
I never met this person, but in terms of a guiding figure,
Yeah.
I think a lot about Steve Jobs.
Yeah.
And specifically in the healthcare sense.
Oh,
Because do you know what the technology that was the fastest adopted technology before OpenEvidence was among physicians?
based on the context, my guess is going to be the Apple Watch.
iPhone.
Okay.
Was, like we're in now with this AI movement where there's so much happening so quickly, right? And so much, like I said, up in the air and changing. That was a previous period where there was this introduction of new technology. I was just talking earlier with some physicians that were talking when they got their first iPhone. First it was an iPod Touch and then an iPhone. And what a change that was to level up from textbooks to all of a sudden still static content, but just have that right there in your pocket. And so, that's a really cool kind of precursor in a lot of ways that mirrors a lot of this. But, and then just as an individual, right, like Steve Jobs is absolutely incredible. And I think he has some of the best kind of philosophies for building a company, for innovating. And he's an absolutely aspirational figure for how to build things for real and make things in practice.
I love that. There's I love Steve Jobs as a hero there because there's this uncompromising quality and focus on design.
Yeah.
So last question, and it's totally optional.
I don't know.
Dr. Lee, we are 1 minute.
Hey. I was friends with Danny.
Okay, yeah.
I love to talk. Yeah, it's a furniture kind of love. It's a CMS and I learn with the Bayesian reasoning and writing.
Yeah.
How to educate the next generation.
Yeah.
And talk to George Staley about either George Harperman's.
Okay.
Your team.
Okay.
Hey,
Awesome.
spend some time with Danny.
Yeah. My co-founder for that thing.
He became
He's a special person, yeah. Yeah. Thank you.
Hell yeah. Harvard Connections live on the globe. Last question, Zach, and it's totally optional. Do you have a spicy healthcare hot take?
I don't know actually if this is a hot take, but I think that AI is only going to extremely positively impact all of our lives. And there's so much concern and fear, right, and anxiety around AI. Is it taking people's jobs? Is it leading to AI slop? If you go on the internet, it's almost exclusively negative, right? OpenEvidence shows that there are ways for it to literally save lives, right? For it to impact the world at a very large scale in a way that's extremely positive. And it's very easy to be negative on stuff, and it's very easy to point out problems. I think we'll look back a year, 2 years, 3 years, and certainly much farther than that, and see this as a really important step function for the whole world. I see that in the clinician space for OpenEvidence. I see that as an engineer in coding tools. And I think as this percolates farther through to society and people start seeing the reality every day as part of their jobs, it's going to be very clear just how positively beneficial AI can be for the whole world.
I'll take it. Some of that sentiment reminds me of some things that Alvin Wayne Grayland talks about. I don't know if you're familiar with Alvin. He's a former leader at HTC, but very much interested in AI in this direction. Zach, it's been fantastic to chat with you. Thank you so much for sharing some of your very busy day here at Hell. And, just fantastic work. I think that optimism of how powerful AI can be has got to be partly a product of how incredibly successful you've been able to be in the last 4 years building with it, right? And while many of us are still trying to find our paths, you're here trailblazing with outcomes and centering doctors in a way that a lot of folks seem to have a hard time doing. So bravo. And
Well, thank
thanks
you.
for joining us on the Health Tech Glow Up.
Thanks for having me.
Amazing. We got one last thing. We're just going to clap it out.
Okay.
1, 2, 3. Amazing. So 1, 2. Awesome. Hello and welcome to the Health Tech Glow Up. I'm Nathan C. And today I'm talking with Aditi Joshi of Ardexia. Aditi, it is so good to see you. Thanks for joining me on the Health Tech Glow Up.
Thank you. Thanks for having me. And hello, everybody.
Amazing. Can you introduce yourself and the work that you do at Ardexia?
Yes. Thank you for calling me an icon. I'm going to live off that now. But
Yeah.
so this is a new company for me, and we've known each other for a few years. We know what we want to do for healthcare, but it's just not happening. Just so looking back at everything I've built, and I've realized that we've got great technology. People really want to help in healthcare. We have leadership and laws, and everybody's involved. But we still haven't been able to really get doctors to want to use it successfully. There are health systems, there are government programs, there are clinics. People are sitting on technology that isn't being used. And so I thought to myself, over these last 12 years, what has worked? What have I seen actually work to get doctors to actually want to use it? And that's what we're doing, and we're fixing.
Are you able to share what it is you've seen that doctors actually want to and do use?
Yes, I will say that the biggest problem is that people don't really understand how doctors work. The biggest take is that we don't really have bosses. We have people who have oversight, but once you're at the standard of care, we don't really have bosses. We are able to see our patients and decide what we want to do. We have to do the right thing for them, but that's it. So you can't actually go into a health system. You can't be like, hey, everybody, you've got to use this tool. If there is a tool that already works and is great for patient care, you cannot force us to do it. It's just not happening. You have to look at what are the actual pain points? What do we want better for patient care? What is the actual behavior and psychology of the doctors at that practice that's stopping them from using it? What are the real pain points? Who's the leadership? You got to think about all of those things.
My suspicion is just for the sake of example, right? Like a podiatrist and an oncology doctor are going to have incredibly different drivers, even though they might sort of have some of the same credentials, or you could put the same labels on them.
Yes.
So what's your approach for helping technologies better understand and activate doctors?
So I put it out. I looked at my playbooks and I just basically put it out there, and I figured, all right, these are the steps that you need to take. So the first thing we have to do is actually validate it. And I'll tell you, Nathan, I know it works. I have done it multiple times, but I need to make sure that it works in this context. And then once I do it, I'm going to build an app around it. So looking for any tech co-founders, if you know anybody who might be interested.
Interesting. This is totally like curiosity around innovators and the choices they make. In excited circles, there's a lot of people that say you don't need a technical co-founder anymore because you can prototype and create a number of proof of value apps with AI code assistants. What's your thoughts as a founder?
I'll say that AI has come really far, and it's actually really exciting what you can do with it. But I will fully admit this. I have taken on a very ambitious, complicated problem. And so I did actually try creating an app using the playbook that I did. It does part of it, but it does not get everything that I want. And so I know that I'm going to need somebody who has a little bit more experience to make exactly what I'm looking for to do.
Yeah. Along with that intuition and that experience, right? Like back to the top, I've done it before. I've seen what works. I'm curious. You're kind of multi-hyphenate. You've got these many strengths. What was that origin story, that moment that inspired you to kind of take this innovation path when you have so many tools at your disposal?
Oh, yeah. So I'll say that in general, emergency medicine, we tend to be innovative because we have to think on our feet. We have to really make sure that we're going in the right direction. And if it's not, we got to change paths. But really, my story was I got burnouts and I really could not work in the emergency room at the level that I was doing or the amount of time that I was spending there. And so I was looking for other things, and I applied for a telemedicine company, and I just really loved what they were trying to do. And I will tell everybody this: you cannot just try to escape your burnout by going into a field like this unless you actually love it. I actually loved it. I found it useful. I understand how we improve access to care. I saw patients, I have multiple stories where I helped them and really understood what it's like for patients at home, which I don't see in the hospital setting. And it really gave me an understanding of what technology can really do to help people in their homes.
So let's look at the conference and the setting that we're in, sort of dive in to health itself. I use the idea of a glow up or a noticeable transformation or a rebirth as a way to talk about goals and how we grow into the future. Thinking at the industry level, and maybe it's for doctors, maybe it's a little bit larger, what's the glow up that you're wanting to see in the healthcare and health technology space?
So yeah, in that health technology space, I am seeing this blow up and I want more of this.
I like this.
There's a lot more clinicians here and they have a real voice, and there's a lot of clinician builders, founders here. Not just, on the exec team, not just advisors, there's actual builders and founders. That's really important because for so long we were told we're not good at business, we're not good at speaking on these topics. And I think we're getting past that where we don't actually have to have those skills. We can find co-founders, we can find those skills just like everybody else does, right? I love that I'm seeing that trend.
So for those who might be watching the tech blow up who aren't familiar with healthcare technology, I think it might be shocking, honestly,
Sure.
that doctors haven't always been involved in some of the tech innovation, some of the tech innovation that has happened to date. And that a lot of solutions kind of solved technical, physical, clinical kinds of problems, but weren't necessarily even including, to your point at the top, the people who are supposed to be using the tools and saving them time.
Yeah, I was shocked too when I found this out. But it was like, it's been a long time that this has been going on.
I've also heard the voice of doctors, the voice of nurse, the voice of patients. I can see the light from here. That is one of the things that this event fair is very good at centering, like literally giving prime center booth space. So
seeing it everywhere.
Props to health.
Yes.
All right, so let's bring it in. Entrepreneur, newly started company. 6 months can be a lot of time, can also be a very little amount of time at this stage. What's the glow up that you're looking for to make it Ardexia in the next 6 months?
So first things first, I've had burnout twice. This time I'm going to build. So that's the first thing I'm doing. Yes, exactly.
You got a plan for it.
Yes, you have to plan for it. I'm saying this right now. And so when we talk about 6 months, I'm not going to say, all right, I'm going to have this all done by 6 months. What I'm going to say is, in that time, I want to know how those problems are really affecting doctors, all of my research in there, and starting that validation. If it's done, that'd be amazing, but at least getting into that validation portion. And hopefully I'll have that tech co-founder, at least some ideas on the tech co-founders out there who might be interested in this problem.
Hell yeah. I'm always going to be excited when somebody's like, I'm going to be doing more research. I'm hoping to be at this. I knew that I couldn't start a business that was going to burn me out and support my family in the way that I wanted to for the business. And so can't burn out, have to have balance, have to be mentally healthy as part of the business plan. Like it's in the foundational values for how Awesome Future is supposed to run. Because how else am I going to protect it? As a CEO and as the only employer in house.
So true. I love that you did that and you put in the business plan, because if you burn out, you can't actually build anything. You're not grounded. You have no energy to do it. And I know myself, I'll just get too hard on myself and really want to do something.
But your brain cannot think strategically and creatively if you're in fight or flight.
It's true.
When you're in the wrong part of the brain, like you're physically not capable. You can't hustle your way through that. It's like a physical meat barrier, and I love it. So, Aditi, the theme for health this year is heroes and legends. I think this is a fantastic opportunity to ask CEOs, leaders, product founders, innovators, who are those mentors and heroes that encouraged you along the way? Like sometimes it can take just one person believing in you, in your idea, in your potential. So who helped you get to the point where you are?
And I love this question, and there's been so many people, but I will say that what probably some of the ones I can really think of that really helped me were the ones that recognized that telemedicine is important. They may not have been in telemedicine, but colleagues who are like, we want you to be the voice, and we want to make sure that you actually grow this out. And I've had multiple ones. My boss at Jefferson, my colleague at Jefferson, who also made sure I had more opportunities to write papers and do research. I mean, all of that really made me realize that I can do this. But I gotta say, you know, and this is such a cliche answer, but I remember even when I wrote my book, like I remember thinking all of the patients that I saw, because I will tell you, I have like memories of certain patients and I just was like, oh my God, I remember how it helped you. And I remember what this did for you, both from the emergency department and on telemedicine visits. And really all of that, it's really why I do it, because otherwise, I mean, this is a hard problem.
Those stories of the people that you were able to help and learn from stick with you no matter what.
Yes.
And how cool that it's like the people that you were able to help and engage on their health journeys now coming back as like advisors and encouragement. I love that so much.
Yeah. I love it. Yeah.
So on a total tone shift, do you have any spicy ideas you're willing to share with us?
Absolutely. And I don't know if you know it's spicy, but I'm going to say that I'm seeing AI everywhere. And it's like, honestly, it's lost its meaning. There's no differentiation. And so for me, when I'm walking around, I'm like, okay, well, you're using AI. Now I need to know what you're doing with it, what kind of AI you're using. Because I'm going to tell you, I've been talking to people and I've been trialing things out. And if your base or back end AI or LLM doesn't have certain features, it is missing out on some of the ambient AI. It is taking things out of context. It's giving wrong answers. So just what kind of AI are you using? And then how are you using it? Because I don't want to hear about AI anymore. I want to know what it's actually doing. Everybody has AI. So tell me something different.
Tell us about your outcomes.
Yes. Yes, please.
I love that. That's amazing.
Nice.
Aditi,
Nathan.
we've got the mic. We've got the opportunity to share anything you'd like about Ardexia, what you're looking for in the next few months.
I would love to know if anybody is really looking on how to improve this. I want to talk to you. Not even necessarily for the validation or even as a client, but I want to hear your stories. I want to know what's going on. Because really, this is a problem I want to solve. I want to make these tools usable by clinicians and that hospitals will actually adopt them and continue to do it. Because if we don't use them, they're just going to go away. They're just going to sit there unused on a shelf and patients are not going to get the care that we can deliver through technology.
Do you have metrics on the cost or the lost value of like digital transformation that's unused
Billions.
in healthcare?
Billions.
It's probably trillions.
It's 87 billion.
It's at least, okay.
Per year contracted. So you're looking at not only the investment, but how much they're losing in a hospital by not using and seeing patients and getting reimbursed for that care.
A 5-year contract is a 5-year contract,
Yeah.
even if the nurses don't touch it in the EHR.
That's right. Cool. Right?
I'm going to actually, a 5-year contract is a 5-year contract, even if the doctors don't touch it in the EHR.
That's true. And it's
I'm not going to throw nurses under the bus.
doctors and nurses. It's not even us doing it. If we, doctors will turn these tools off if it's not useful. And you have to actually talk to them and figure out why it's not useful and then fix it. Most doctors don't have time. They're not going to sit here and just like try to fix it for you. They're just going to stop using it. That's actually what happens.
Literally turn it off. This is
Yeah.
wasting too much of my time to learn.
Exactly.
Oh, I'm so glad I asked that follow-up. Thank you. Aditi, it has been such a fantastic pleasure to check in and to see everything that you're doing at Ardexia. The research foundation, that desire to drive outcomes and actually make a difference and help your peers also make more of a difference, right? With the tools that we've already bought is such an incredible mission. I hope we can have a follow-up in a year so we can hear more
Yes.
about everything you've been building.
I would always love to follow up with you. So let's do it. Thank you for
Awesome.
having me, Nathan.
Yes, and now we got to clap it out. 1, 2, 3. Thank you.
Thank you. Have fun.